Welcome to Dr. Madhu's MedEd International, where we bring you clear, clinical, and concise concepts. Let's get into today's lesson. Welcome. In this video, we are going to understand the brachial plexus, one of the most important nerve networks supplying the upper limb. Confused about brachial plexus? Many students find the brachial plexus confusing because of its multiple levels: roots, trunks, divisions, cords, and branches. But once you understand the pattern, it becomes very logical and easy to remember. The brachial plexus is formed by the anterior rami of spinal nerves C5, C6, C7, C8, and T1. These 5 nerves emerge from the spinal cord in the neck region and combine to form the complex network that supplies the entire upper limb. The roots of the brachial plexus give rise to 2 important nerves that are frequently asked in examinations. The first is the dorsal scapular nerve, which arises from the C5 root. This nerve supplies the rhomboid major, rhomboid minor, and levator scapulae muscles, which help in retracting and elevating the scapula. The second important nerve is the long thoracic nerve, which arises from C5, C6, and C7 roots. It supplies the serratus anterior muscle, which plays an important role in stabilizing the scapula during arm movements. Injury to the long thoracic nerve leads to paralysis of serratus anterior, producing the classical clinical sign known as winged scapula. Remember, roots give 2 important branches: dorsal scapular nerve, long thoracic nerve. The roots combine to form 3 trunks. C5 and C6 join together to form the upper trunk. C7 continues alone to form the middle trunk. C8 and T1 combine to form the lower trunk. The trunks of the brachial plexus also give rise to a few important branches. The upper trunk, formed by the union of C5 and C6 roots, gives 2 important nerves. The first is the suprascapular nerve, which supplies the supraspinatus and infraspinatus muscles. These muscles are part of the rotator cuff and play an important role in shoulder movement and stabilization. The second branch is the nerve to subclavius, which supplies the subclavius muscle. An important exam point to remember is that the middle trunk and lower trunk do not give any branches. Each trunk divides into 2 branches, an anterior division and a posterior division. In general, anterior divisions supply the flexor compartments of the upper limb, while posterior divisions supply the extensor compartments. The divisions of the brachial plexus reorganize to form 3 cords. These cords are named according to their relationship with the second part of the axillary artery. The lateral cord is formed by the anterior divisions of the upper and middle trunks, and it lies lateral to the axillary artery. The medial cord is formed by the anterior division of the lower trunk, and it lies medial to the axillary artery. The posterior cord is formed by the posterior divisions of all 3 trunks, and it lies posterior to the axillary artery. Let's now look at the branches arising from the cords of the brachial plexus. The lateral cord, which has root values C5 to C7, gives the lateral pectoral nerve, mainly supplies the pectoralis major muscle. The medial cord, with root values C8 and T1, gives several branches, including the medial pectoral nerve, which supplies both the pectoralis minor and pectoralis major muscles. The medial cutaneous nerve of the arm, which carries fibers from C8 and T1. This nerve provides sensory supply to the skin of the medial side of the arm. The medial cutaneous nerve of the forearm, also derived from C8 and T1. As the name suggests, it supplies sensation to the skin on the medial aspect of the forearm. The posterior cord gives important motor branches to the muscles of the posterior compartment. These include the upper subscapular nerve, thoracodorsal nerve, and lower subscapular nerve. The upper subscapular nerve supplies the subscapularis muscle. The thoracodorsal nerve, also called the middle subscapular nerve, supplies the latissimus dorsi muscle, which is responsible for powerful extension and adduction of the arm. The lower subscapular nerve supplies the subscapularis and teres major muscles. Understanding these branches helps in identifying the level of nerve injury in the brachial plexus. The cords of the brachial plexus give rise to 5 major terminal branches. These nerves supply most of the muscles and skin of the upper limb. The musculocutaneous nerve, arising from the lateral cord, supplies the flexor muscles of the anterior arm, such as biceps brachii and brachialis. The axillary nerve, arising from the posterior cord, supplies the deltoid and teres minor muscles and provides sensation over the deltoid region. The radial nerve, also from the posterior cord, supplies the extensor muscles of the arm and forearm and provides sensory supply to the posterior aspect of the upper limb. The median nerve, formed by contributions from both the lateral and medial cords, supplies most of the forearm flexors and the thenar muscles. Finally, the ulnar nerve, arising from the medial cord, supplies many intrinsic muscles of the hand and provides sensory supply to the medial 1.5 fingers. A simple mnemonic to remember these terminal branches is MARMU. Let's now review the major nerves of the brachial plexus, along with their origin and the muscles they supply. Starting with the roots, the first branch is the dorsal scapular nerve, which arises from the C5 root and supplies the rhomboid major, rhomboid minor, and levator scapulae muscles. Another important root branch is the long thoracic nerve, arising from C5 to C7, which supplies the serratus anterior muscle. Injury to this nerve produces the classic winged scapula. Moving to the upper trunk, we have the suprascapular nerve, arising from C5 and C6, which supplies the supraspinatus and infraspinatus muscles. These are part of the rotator cuff. Also from the upper trunk is the nerve to subclavius, which supplies the subclavius muscle. From the lateral cord, the lateral pectoral nerve arises and mainly supplies the pectoralis major muscle. From the medial cord, the medial pectoral nerve arises and supplies both the pectoralis minor and pectoralis major muscles. Now looking at branches from the posterior cord, the upper subscapular nerve supplies the subscapularis muscle. The thoracodorsal nerve, also called the middle subscapular nerve, arises from posterior cord, supplies the latissimus dorsi muscle, which is responsible for powerful extension and adduction of the arm. The lower subscapular nerve arises from posterior cord, supplies the subscapularis and teres major muscles. Finally, the terminal branches of the brachial plexus arise from the cords. The musculocutaneous nerve from the lateral cord supplies the biceps brachii, brachialis, and coracobrachialis muscles of the anterior arm. The axillary nerve from the posterior cord supplies the deltoid and teres minor muscles and is important for shoulder abduction. The radial nerve, also from the posterior cord, supplies all extensor muscles of the arm and forearm. The median nerve, formed by contributions from the lateral and medial cords, supplies most of the forearm flexor muscles and the thenar muscles of the hand. Finally, the ulnar nerve, arising from the medial cord, supplies most intrinsic muscles of the hand, flexor carpi ulnaris, and the medial half of flexor digitorum profundus. One important clinical condition is Erb's palsy, which occurs due to injury to the upper trunk of the brachial plexus, involving C5 and C6 roots. The characteristic posture is called the waiter's tip deformity, where the arm is adducted, medially rotated, and the forearm is extended and pronated. Another important clinical condition is Klumpke's palsy, which occurs due to injury to the lower trunk, involving C8 and T1. This leads to paralysis of intrinsic hand muscles and produces a characteristic claw hand deformity. Thanks for watching. If you found this helpful, please subscribe, like, share, and comment for more clinically clear medical education.